Now moving on to the shape of the artificial anterior teeth. Under shape of the artificial anterior teeth, again pre-extraction records in the form of diagnostic casts, photographs, radiographs, extracted teeth or teeth of close relatives can be used. Next, we again use the facial form which was given by Leon Williams classification for determining the shape of the anterior teeth. You can see the shape of the anterior teeth. This is square facial form wherein the reference landmarks are the bizygomatic width as well as the angle of the mandible. When you draw two lines and when they are parallel, it is square facial form. When the lines, instead of being straight, if they are curved, it is ovoid facial form, and if the lines are convergent towards the chin, it is tapering facial form. Now these can be used for selection of the shape of the artificial anterior teeth. The shape can also be determined with the shape of the arch form. If it is a U-shaped arch form, we select a square-shaped teeth. If it is a V-shaped arch form, we select teeth which is in the form of a tapering. And then if the arch form is in the form of U, then we try to select a ovoid shape of artificial anterior teeth. Then we move on to the profile of the anterior teeth. Now we understand that the profile of the anterior teeth is not straight, instead it is slightly convex. Now there are three types of profiles. One is straight profile, the other one is convex as you see in this picture, the other one is concave. Concave teeth is very rare, but it usually occurs with more, it is seen in class 3 situations or in teeth where or in situations where the jaw is more prognatic. In class 1 and in class 3 situations, we select labial surface of artificial anterior teeth with less convexity. But in class 2 skeletal relationship, which has a convex facial profile, we try to select artificial anterior teeth with a more convex profile. Now, the curvature of the tooth can also be determined in Ilster years, and plaster index was used for determining the curvature of the anterior teeth with the help of the nose curvature. Then we move on to the shade or color of the anterior teeth. We have three basic elements: hue, value and chroma. Hue is the basic or dominant color of an object, and chroma is the degree of saturation of a particular color. Value is nothing but the lightness or darkness of an object, and low value refers to dark colors and high value refers to light colors. And translucency. Translucency is the ability to permit the passage of light, and we know that the enamel is a translucent material. So what are the factors that influence the selection of color of anterior teeth? This is the age, complexion, color of hair and color of eyes. Today we cannot determine the color of hair and eyes because each person tends to change the color of hair and eyes. And complexion, we have to ensure that the complexion of the facial complexion color is in correspondence with the color of the artificial anterior teeth. Now doing a sage selection, we instruct the patient to come in the morning before 10 a.m. and we ensure that no LED lights or incandescent lights are used while sage selection. Natural daylight is used, and these shade tabs are placed under the lips of the complete denture patients for viewing the facial form in toto instead of just directly looking at the teeth. Then we squint one eyes, and so that we are able to get more focus, and without any eye fatigue we just select the shade at one shot so that we are not getting confused with the shade selection. There are various materials with which anterior teeth are selected. One is acrylic resin, composite resin, metal insert teeth, and interpenetrating polymer network teeth which has high impact or increased wear resistance. Then is porcelain teeth. We have another important concept in selection of anterior teeth, one that is called as SPA factor or dentogenic concept or dynaesthetic. It was given by Fresh and Fisher. He considered three factors. One is the gender, the other one is the personality, and the other one is the age of the patient, which was used as criteria for selection of the anterior teeth. If according to the gender, he felt female patients had rounded incisal angles and lesser angulated teeth, the laterals could be overlapping the centrals, and premolars are considered the aesthetic zones. The entire thing is opposite for male gender. It is less rounded, canines are more prominent, cervical region is more prominent. When we move on to the second trait which was used, that was the personality, he divided people into two categories as vigorous and timid personality. Now, vigorous personality had